Treasurer, good morning. 473 cases in yesterday's figures. That makes now 3,507 active cases of coronavirus in the state. 3,503 of those are locally acquired. We have 157 Victorians currently in hospital with COVID. 38 of those are in intensive care, and 26 of those are on a ventilator. And of course, we send our very best wishes to everybody who's recovering from COVID in our state at this point in time. Like recent days, like in fact the last 2 weeks, 91% of the last 24 hours cases are all in our northern and western suburbs. We have 338 cases in our northern suburbs, in key suburbs such as Craigieburn, Roxburgh Park, Meadow Heights, Broadmeadows, and Glenroy. In our western suburbs, we have 97 cases in suburbs such as Truganina, Altona North, and Tarneet. And in our southeastern suburbs, we have 23 cases in Casey, Cardinia, Dandenong, Berwick, and Clayton. And there are 9 cases in our eastern suburbs, including Doncaster East and Ferntree Gully. Of the 6 cases in regional areas, 3 are from Mildura and are all primary close contacts of the existing case we discussed a few days ago, and 3 are in Geelong, again, all known primary close contacts of 2 existing cases. Again, no new exposure sites to report on any of those, which is encouraging. That makes our total of 473 cases in the last 24 hours. Of the particular exposure sites of interest and concern, we continue to obviously focus on the Box Hill construction site, now 120 active cases in total. That's now starting its day 13 testing today. Obviously, we're very keen to try and get to the end of that particular cluster. In addition, recently we've discussed the Fitzroy Community School. There are now 31 positive cases associated with the school. There are 189 primary close contacts, and we'll of course be continuing to support the school community to test and to isolate over the days ahead. We have 1 further case at V-Line. That now takes us to 5 positive staff cases in total with V-Line. The latest case acquired the infection, we believe, in their tea room. A lot of work happening over the last 2 or 3 days with V-Line as we work to identify which of their drivers and staff are associated as Tier 1 exposures and which ones are Tier 2. My thanks to the whole V-Line team for working through those details, and of course still challenging times ahead as we work through the details of that. We have 1 positive case at a Ballarat residential disability site. This is somebody who resides in Metro Melbourne but works at the Ballarat facility. They were infectious on the 9th and 10th of September when they worked an overnight shift. There are 10 primary close contacts, but I'm pleased to confirm that of the 4 residents there, 3 have been vaccinated, and we'll obviously hope to get those test results over the course of today. And finally, at the Ascot Vale public housing site, we have no new cases today, 6 cases in total across 4 different households, and a number of those households have moved into alternative accommodation. Testing, of course, continues to be a really strong and critical part of our armoury as we work to identify how far the virus has spread into our wider community. Just over 49,000 tests yesterday, really strong demand in the north and west. And again, we see strong demand in the north and west this morning. And please, again, I'd urge all Victorians, if you have any symptoms, no matter how remote, please come forward to get tested quickly. We have over 200 testing sites. We have many testing sites running extended hours. We have live waiting times on our website and active redirections in place. So if you need to get tested, you'll be able to get tested quickly and safely and have your results by the next day. We, of course, continue to do our day 13 testing protocols for primary close contacts, and another 1,359 primary close contacts were released over the weekend. And again, my thanks to them, and my thanks again to the many thousands of people who are currently isolating, either as cases or primary close contacts for doing those hard yards. And by isolating, you're keeping the rest of us safe and giving us all the best possible chance of avoiding ongoing community transmission across our city and state. As the Minister said, it's been a very busy time in our vaccination system. 66,500 vaccinations over the weekend. our busiest ever weekend. That's almost 10,000 vaccinations more than previous weekend. So my thanks to everybody who's come forward to get vaccinated in the last few days. And of course, the very busy now staff at all of our vaccination clinics across the state. We also saw 62,000 bookings made yesterday for future vaccine appointments. And again, please, I'd urge everybody, not just construction workers, but everybody to please come forward and get your vaccination done. With 2/3 of all Victorians now having had their first dose, it really is time for us to get on with the remainder of our community and to also start moving through our second doses. Even just in the next 7 days, we have 2,200 free Pfizer appointments available and 12,000 free AstraZeneca appointments available, and more appointments are coming on stream every day. As we receive more vaccine, we of course put it straight into our clinic so people can get it into their arms. In terms of first dose allocation or rollout across the state, for Victorians over the age of 50, 80% of them have now had their first dose. And it's great to see older Victorians now at least having got to that milestone. For those in their 40s, 3/4 have had their first dose of vaccination. For those in their 30s, now over half, 55% have had their first dose. And for those Victorians aged between 18 and 30, 44% have had their first dose. And finally, and really encouragingly, amongst 16 and 17-year-olds, over a third, 34%, have now had their first dose. Again, it shows that we're making really good progress over the last few weeks. And of course, we expect to have a really knockout vaccination drive over the coming weeks ahead. In our state clinics last week, we did 251,000 doses of vaccine. We're aiming to do 280,000 doses this week and to push for even further ahead over the weeks ahead. Finally, can I just thank, in particular, the essential workers who keep us all going during these complex lockdown times. The people working in our supermarkets, the people working, of course, in construction, and the people working in our health services and hospitals to keep all those critical services going whilst the rest of us are working from home and doing our best to isolate. It is so important that those essential workers also follow all those protocols. So please, in particular, we'd ask you to obviously be really careful at work and make sure that you understand your local employer's COVID safe plan. You're doing everything you possibly can to protect yourself. With 3,500 active cases of COVID in our community and with cases across Melbourne, it's so important that you're so careful about who you might be coming into contact with at work. I particularly call out Tearooms. We've seen a number of cases in recent times, including the V-line cases, including some of our construction sites, where transmission appears to be happening in Tearooms. It's where we probably drop our guard the most. It's where we physically drop our masks to eat and to drink. It's also where we see people from different shifts and different workplace bubbles still interacting with each other. Please, Tearooms are not safe places. In fact, for many of us at work, they're probably now the most dangerous place. So please be very mindful of everything you do in that environment and minimise your time in that kind of setting. Secondly, for those authorised workers moving into regional settings, you're able to do so by the nature of your work, but please be very careful for whom you contact. As we've seen with the case of our Ballarat worker, it is so, the potential for you to be taking the infection from Melbourne into regional Victoria is significant. It's very real, and it'll be down to the strength of the workplace procedures and how you conduct yourself in regional Victoria as to whether you pass it on to other people. So we please ask all authorised workers who are going legitimately into regional Vic to be very, very careful. And finally, please come forward and get vaccinated. As the Treasurer said, we have now made a number of additional vaccination options available, particularly to construction workers, additional hotlines to book dedicated vaccines, as well as additional walk-up facilities, all with a focus of getting you as safe as we possibly can at these critical times. With that, I'll hand back to the Minister for questions.
Jeroen, before you leave, do you have a breakdown of the number of the ages of the people in hospital, given 80% over 50 have had their first dose?
I don't, Mark. I can put it up in the Cho release this afternoon and we can talk about it another time. Okay.
Do you also know our R number at the moment by any chance?
No, I don't have that, but I'm sure that Cho can update that later on.
Jeroen, of the 31 people that have tested positive a part of the North Fitzroy school, do you know how many of those are children?
No, I don't have the breakdown down. I know all 31 are directly associated with the school community. Obviously, we'll expect to see, particularly over the coming days, PCCs. I'm happy to give you a breakdown in the Cho release this afternoon.
Do you have any details on a positive case at the Melbourne Remand Centre?
No, we understand there is a staff member who is a positive case at the Melbourne Remand Centre. Obviously, we're doing our usual protocols of testing extensively across both the staff cohorts and where necessary to people who are residing there. But at this point in time, we have no evidence of any onward transmission.